John Liguori is our guest on 800 CHAB as we look forward to the 800 CHAB Family First Radiothon, the 9th annual, to raise money to buy new equipment for, first of all, the Moose Jaw Health Foundation, which will in turn buy new equipment to equip our brand new hospital. John Liguori is the Vice President in charge of the new hospital project with the Five Hills Health Region. John, you know from the success of previous radiothons how much a difference a few dollars can make. When you add it all up and it starts getting into big bucks and hundreds of thousands of dollars, and we buy that brand new equipment for our medical professionals to work with, it really does make a difference. I mean, it helps attract and retain healthcare professionals, and it makes our healthcare system better locally, sir.
Absolutely. The level of sophistication, if I can call that, with some of the new equipment associated with the new hospital, it's remarkable. When we look at our surgical program, for example, our operating rooms are going to be state-of-the-art. I'm venturing to say, anecdotally to some degree, that they'll probably be the best equipped operating rooms in the country the day we open. Of course, as you know, there was a significant commitment and announcement made with the MRI technology. That's going to be a huge improvement in terms of diagnostic imaging for our patients, and certainly that will assist our patients because it'll allow our healthcare providers, which is an array of different specialists, but particularly our physicians, to be able to treat and diagnose things much quicker. And as you know, presently, all of us have to travel out of Moose Jaw and area to get an MRI, so that'll be a huge improvement to have it right here at home. There's many other things. For example, the infrastructure for our IT, the computer systems, is going to be first of its kind in Canada. The technology is called GPON, which is really using fiber versus traditional copper, right, or Ethernet, and that stands for gigabit optical network is what it is, right? Passive optical network, the GPON, versus the traditional Ethernet base. So that in itself is a huge improvement. And what it'll allow us to do, all modern healthcare equipment is moving to a computer or IT-based structure, right? So it'll position our new hospital to have the infrastructure for many, many years to come, to not have to worry about having to upgrade that key technology that pretty much makes everything work, right? And so that's a huge plus for us. And those are just some of the examples. There's many others.
You mentioned the fact that along the way it's been an opportunity for you and others at the Five Hills Health Region to learn, and also with the ministry. There are a lot of firsts, a lot of things that are happening with this new Moose Jaw Hospital that have never been done before in Saskatchewan. There's a lot of eyes on us, sir.
There sure is, and in fact, Rob, a lot of the things we're doing haven't been done in our country. So yes, I get contacted, the same with Cheryl Craig, our CEO, and others. We get contacted continuously from colleagues from other provinces across the country, and even actually we had a group from Southern California that wants to talk to us about some of the work we've done with our new hospital. So it's certainly extended. We've had visitors from India, from Australia, from the UK. We've had some high-ranking federal officials visit us over the last 3 years, and of course a lot of interest within the province, within the different ministries of government within our province. So yes, lots of interest in what we're doing, but our focus has been to do the job that we set out to do, which is get the new hospital operational and running and transition to it. And then we will think of ways of how we could share what we're learning. We're already doing some of that and sharing that with lots of colleagues. But I think there's going to be lots more interest to come once we're in the new hospital. I'll give a little bit.